Have you ever paused for a moment and wondered how much of your life is quietly shaped by forces you cannot see? The human body, in all its complexity, is a remarkable system of hidden connections, delicate balances, and silent conversations that often go unnoticed until a disruption forces us to pay attention. One such hidden connection, which many overlook, lies between the kidneys and the blood that courses through our veins. Chronic kidney disease, or CKD, is not just a condition affecting the kidneys. It is a silent teacher, urging us to recognize the fragility and resilience within ourselves. Often, the most profound lessons emerge from the unnoticed, the subtle shifts that, if ignored, can cascade into significant consequences. Anemia, a condition many patients with CKD unknowingly face, serves as a mirror to this truth. When the kidneys falter, they cannot produce enough erythropoietin, a vital hormone that signals the bone marrow to create red blood cells. This deficiency quietly robs the body of oxygen, energy, and vitality, leaving the individual with fatigue, shortness of breath, and an unexplainable sense of weakness. Yet, the invisible nature of this connection is what makes it so deceptive. People continue to push through their daily routines, dismissing persistent tiredness as a minor inconvenience, unaware that their body is silently struggling. Dr. Mathew R. Weir emphasizes that understanding this hidden link is not merely about medical knowledge. It is a call to attune ourselves to the subtle messages our bodies send. Just as life presents challenges that test our patience, strength, and awareness, CKD and anemia teach us the art of noticing, of listening, and of responding before a small imbalance transforms into a larger crisis. Every heartbeat, every breath, and every cell depends on the intricate dance between organs that we often take for granted. It is in this recognition, this conscious awareness of interconnection, that we find the power to intervene, to reclaim energy, and to improve our quality of life. The journey begins with awareness, for it is awareness that illuminates what was previously invisible. When a person begins to understand the subtle relationship between CKD and anemia, they are empowered to seek treatment, adjust lifestyle choices, and take control of their well-being. This awareness is more than medical. It is deeply philosophical. It invites reflection on how life's hidden patterns, if ignored, can lead to unnecessary suffering, and how conscious attention, if embraced, can open doors to profound improvement. Every patient has the potential to awaken to these hidden truths, to move beyond passive existence into an active engagement with their health, and ultimately, their life. The road may be challenging, but it is in the challenge that resilience is born, and in the seemingly small steps of daily care that transformation occurs. Anemia, though often dismissed, is a signal, a whisper from within that the body needs support, a reminder that ignoring subtle symptoms can lead to compounded difficulties. Dr. Mathew R. Weir notes that by recognizing anemia early and addressing it thoughtfully, patients can restore not only their physical strength, but also their confidence and motivation. There is a philosophical parallel here. Life often presents invisible obstacles, and it is our ability to perceive them, understand their significance, and respond with deliberate action that defines our path. The hidden link between CKD and anemia is more than a medical phenomenon. It is an allegory for life itself, teaching patience, attentiveness, and the courage to act before consequences overwhelm us. In the quiet moments of reflection, when we feel the fatigue settle in, when breath comes a little harder, we are reminded of the importance of listening to our bodies, interpreting the signals we receive, and embracing the responsibility to act wisely. Each step toward understanding, each decision to seek knowledge, and each choice to intervene therapeutically is a step toward reclaiming vitality, energy, and purpose. Awareness is transformative, and in this transformation, the individual discovers that they are not helpless against the subtle forces that shape their existence. The lessons of CKD and anemia extend beyond health. They are about the profound interplay of cause and effect, the hidden connections that underpin our lives, and the empowerment that comes from observing, understanding, and acting in harmony with the deeper truths of our own bodies. As we continue to explore the hidden world within our bodies, it becomes clear that what is unseen often carries the greatest weight. CKD and anemia, quietly intertwined, remind us of this profound truth. For many patients, the realization comes only after months, sometimes years, of persistent fatigue, dizziness, or shortness of breath. These symptoms, subtle at first, gradually intensify, often dismissed as stress, aging, or lack of sleep. Yet beneath this ordinary veil lies a story of imbalance, a silent struggle that can alter the course of life if left unaddressed. Imagine a river, calm on the surface, yet turbulent beneath, carrying debris that threatens the foundations of everything around it. This is much like the interplay between CKD and anemia, appearing manageable on the outside, while internally, critical processes falter. Dr. Mathew R. Weir explains that the heart, muscles, and brain all suffer when red blood cells are insufficient, and the energy that sustains daily life diminishes. What is striking, and what adds a sense of suspense to this journey, is how easy it is to overlook warning signs until the moment when consequences can no longer be ignored. The mind and body are interconnected in ways that we often underestimate, and anemia in CKD patients exemplifies this truth. Fatigue becomes more than tiredness. It becomes a barrier to pursuing dreams, engaging fully with loved ones, or embracing opportunities that life presents. Breathlessness or dizziness can transform ordinary tasks into daunting challenges, silently eroding confidence and motivation. And yet, the danger is not always immediate or dramatic. It grows slowly, like a shadow lengthening at sunset, almost imperceptible until it touches the core of our existence. Here lies the suspense, the hidden tension that keeps the observer engaged. What if these signals are ignored? What if intervention is delayed? What if a seemingly minor imbalance leads to complications that could have been prevented? This is not intended to frighten, but to awaken awareness. Life, much like the body, operates in patterns and rhythms, and recognizing them early allows us to act decisively. Dr. Mathew R. Weir teaches that understanding the connection between CKD and anemia is more than a medical insight. It is a life lesson about vigilance, foresight, and intentional action. The story of anemia in CKD is a reminder that neglect can turn subtle warning signs into significant crises, yet timely recognition can restore equilibrium and vitality. The suspense deepens when we consider how common this condition is, how many lives are quietly affected, and how many patients continue without knowing that the path to improved energy and heart health is available. There is an urgency here that feels almost philosophical. The invisible, if ignored, can dominate the visible. The small, if neglected, can govern the large. And so, understanding the subtle cues of our body becomes a form of wisdom, a discipline of attentiveness, and an act of self-respect. Anemia is not simply a reduction in red blood cells. It is a signal, a messenger from within, reminding the patient to act with care, precision, and awareness. The suspense of the unknown, of what could happen if ignored, mirrors the suspense in life itself, unseen consequences that may shape destinies if we fail to notice the signs. Yet hope is never absent. Knowledge, awareness, and proactive treatment are like guiding lights in a dark forest, showing the path toward improved well-being. When CKD patients recognize anemia and seek proper intervention, they often discover an unexpected resurgence of energy, a renewed clarity of mind, and an empowerment that transcends the physical. Dr. Mathew R. Weir emphasizes that these improvements are not merely medical. They are transformative experiences that alter the way patients perceive themselves, their limitations, and their potential. The suspense, the tension, and the quiet danger of anemia in CKD teach us a deeper lesson. That life, like the body, requires attention, care, and deliberate action. It is through this careful observation and thoughtful response that patients can prevent complications, restore vitality, and embrace a life filled with energy and purpose. The hidden connection between CKD and anemia thus becomes an allegory, reminding us that what is unseen should never be underestimated, that vigilance, knowledge, and timely action are the keys to health and fulfillment, and that every subtle signal, if heeded, can lead to profound transformation and renewed strength. As we reach the culmination of this exploration, it becomes clear that the lessons hidden within CKD and anemia extend far beyond the medical realm. They are a reflection of life itself, a reminder that what is not immediately visible can wield extraordinary influence over our existence. Every patient who struggles silently with fatigue, shortness of breath, or lack of vitality is faced with an opportunity, the chance to notice, to understand, and to act. Dr. Mathew R. Weir reminds us that awareness is the first step toward empowerment, and that recognizing the subtle yet profound connection between the kidneys and red blood cell production is not just a clinical insight, it is a doorway to reclaiming energy, motivation, and purpose. There is a deep, almost philosophical parallel here. Life often presents challenges that are quiet and easily ignored. Yet if attended to with mindfulness and intentionality, these same challenges become catalysts for growth, resilience, and transformation. Understanding anemia in CKD is akin to learning to read the unspoken messages that life sends us. The fatigue that clouds our days, the weakness that limits our actions, the subtle signs that something is off. These are not mere inconveniences. They are invitations to act, to listen to our inner guidance, and to pursue solutions before small imbalances evolve into crises. Suspense lingers as the stakes are real. Untreated anemia can compromise heart health, reduce vitality, and diminish quality of life. But within this suspense lies hope, and it is through knowledge, careful attention, and proactive measures that patients find the power to intervene. The body, in its silent wisdom, signals when attention is needed, and it is our responsibility to respond. The process may be gradual, requiring patience and perseverance, but it is through these qualities that transformation occurs. When patients engage with their health consciously, when they understand the role of their kidneys and the importance of red blood cells, they are no longer passive observers. They become active participants in their own well-being, harnessing information, treatment, and lifestyle choices to reclaim vitality. Dr. Mathew R. Weir emphasizes that treating anemia effectively is not merely about increasing red blood cell counts. It is about restoring energy, improving heart function, and enhancing every dimension of daily life. Each small decision, each step taken towards understanding and intervention, compounds over time, producing results that may seem subtle at first, yet are profoundly impactful. This insight is as much a lesson in philosophy as it is in medicine. Paying attention to what is often overlooked can transform outcomes, not only in health, but in life itself. The hidden link between CKD and anemia serves as a metaphor for the unseen challenges we all face. They may be quiet, gradual, and easily dismissed, but when we attune ourselves to the subtle signs, we gain clarity, direction, and purpose. The same principle applies to personal growth, relationships, and aspirations. Vigilance, awareness, and deliberate action are the keys to meaningful progress. Recognizing the interdependence of organs, systems, and processes in the body mirrors the recognition that every choice, action, and moment in life is connected, influencing outcomes in ways that are sometimes invisible. Hope is the constant thread weaving through this journey. Even when symptoms seem overwhelming, knowledge and attention illuminate the path forward. Anemia in CKD is not a verdict. It is an invitation to act, to improve, and to transform one's life with intention. Patients who embrace this awareness often find renewed energy, mental clarity, and the motivation to live more fully. The philosophical lesson is clear. The unseen does not diminish our agency. It challenges us to expand it. By listening carefully, seeking guidance, and responding thoughtfully, we reclaim control over our health and, by extension, our lives. Dr. Mathew R. Weir, that inspires countless individuals, emphasizes that understanding, awareness, and action are more powerful than fear, passivity, or ignorance. This is the ultimate empowerment: to perceive the hidden, to understand its implications, and to act decisively. As you reflect on your own health, your own challenges, or the quiet signals your body may be sending, remember that every small step toward awareness is a step toward transformation. Every moment you choose to listen, learn, and act adds to the energy, resilience, and quality of life you can experience. Life, like the body, is a network of hidden connections, and recognizing them is both an art and a responsibility. Take these lessons to heart and let them guide you toward better health, deeper understanding, and a more vibrant, intentional life. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.